Stat-A-Dyne wrist hand finger orthosis, clinical advantages is that it's a two-joint product, so it allows us to address the extrinsic musculature. The other advantage of being a two-joint product is that we can eliminate the extrinsics and we can isolate the capsule on the wrist more advantageously. Starting distally, you'll notice that the device looks very similar to the Vector 1 hand CPM. We did that on purpose because of the clinical advantages that the Vector 1 hand CPM offers. For example, if we have somebody who can tolerate more motion on a certain finger, we can actually flatten the arc in the malleable spring to lower a digit. As the hand equalizes in its range of motion, as the patient improves, we can rebend that wire and equalize those digits. In addition, if we have a plate or a screw in one of the joints of the fingers, for example, if we have a plate or screw in the long finger or digit 3 at the distal phalanx through that last joint, we can actually move the finger plate to the middle phalanx, which allows us to still address MP and PIP motion while at the same time neglecting the distal interphalangeal joint. The advantage of having the Stat-A-Dyne wrist hand finger orthosis digit knob is that the device can afford a full composite fist as well as hyperextension. So I will bring the device into a full composite fist so you can appreciate that. But I can also address wrist range of motion. So if I bring my wrist into flexion with my digits that are in flexion, we call this combined motion therapy. If I do combined motion therapy of the wrist and the digits in flexion, I'm actually stretching my long extrinsic extensor musculature. That position is advantageous for people like dental hygienists, also for mechanics who need to flex their wrist and their fingers when doing dental work or when they're working on an engine block. If we do combined motion therapy of digit and wrist extension, then I will actually address the long extrinsic flexor musculature. So now I'm stretching my long extrinsic flexor musculature. This comes in well for somebody who needs to pass a push-up test, perhaps like a police officer or firefighter, or for a waiter or waitress who needs to carry a tray in after a distal radius fracture. Functionally, this obviously allows us to open doorknobs when going in and out of different rooms, wrist and digit extension. If we incorporate the theory of tenodesis and we keep the fingers in hyperextension and bring the wrist in flexion, the advantage of this position is that we've now taken the long extrinsic extensor musculature out of the equation. So if you visualize this glove as my long extrinsic extensor musculature, you'll see how the glove has slack in it, which allows us to address the dorsal wrist capsule more advantageously. This will isolate the stretch here on this capsule by eliminating the long extrinsic extensor musculature. Once again, if we examine the principles of tenodesis and we put the fingers in full flexion, but bring the wrist in extension, we have now eliminated the long extrinsic flexor musculature, which allows isolation of the volar wrist capsule. So I will stretch my volar wrist capsule more advantageously here by taking the long extrinsic flexors out of the equation.